Hi there, Maya. What's up? I haven't seen you at the park in a while. Where have you been?
Hi, Janie. I haven't been feeling up to exercise much.
Why not? Have you been sick or did you get hurt?
It's kind of embarrassing.
Come on, Maya. You know you can tell me anything.
Well, I was having a lot of pressure in my pelvic area. Well, more like my vagina. And then I looked at myself in the mirror and I was horrified to see something there, like a tumor. I called my gynecologist right away, and it turns out my bladder was falling down, which I guess explained why I was having trouble with holding my urine too.
That sounds awful. I thought that only happened to old ladies.
Me too, and while I was pregnant. Anyway, my gynecologist told me that it's a common condition and there are specialists for it called urogynecologists. I was able to see the specialist the very next week. It was the longest week of my life thinking I was going to need emergency surgery or something.
You didn't? I would want surgery right away if I had a tumor coming out of my vagina and if I was leaking urine all over myself.
That's just it. It wasn't a tumor, and I wasn't leaking all the time, just when I coughed or sneezed or went running in the park. So I just started to avoid all those activities. And the pressure symptoms were just that, pressure, discomfort, and it wasn't clear to me what was happening at first. And when I first told my gynecologist about the leaking last year, he just said to do my Kegels, and I thought I had to live with it. It wasn't until last month, when I was freaking out that I thought I had a tumor, that he sent me to see the specialist. And boy, am I happy I went.
Why? What did he say?
The specialist was wonderful.
Hi, I'm Dr. Kim. I see you were referred here for urine leakage and a cystocele, which people also call dropped bladder or bladder prolapse. Why don't you tell me in your own words what is bothering you?
I'm feeling pressure in my vaginal area, and it looks like there's a tumor down there. I also leak urine when I laugh, cough, sneeze, and run.
That must be distressing for you. I'd like to do a pelvic exam, and then I can give you a better understanding of what is going on. Let me explain what I found on your exam. You have a cystocele, which is the term we use when the front wall of the vagina, with the bladder behind it, is not being well supported. Your uterus is well supported, and the back wall is well supported too. The leakage you are describing, and that I was able to demonstrate today on exam, is called stress incontinence, and it is in part a result of poor urethral support. Both of these issues can be related to damage to your pelvic floor during childbirth. They are not dangerous but can be bothersome. There are several treatment options available, and what you choose is completely up to you. Option 1 is doing pelvic floor exercises, or Kegels. Only 50% of women do these well on their own, so often we refer to a physical therapist to help you do them better. Option 2 is a pessary, which is a silicone disc inserted into the vagina to provide support to the vagina and urethra, and option 3 is surgery.
I really don't want surgery right now. Tell me more about the pessary.
A pessary is a device that is made of medical-grade silicone that is designed to lift the vaginal walls to make you comfortable. It can support the urethra to prevent urine leakage as well. For women who are having difficulty urinating, it can help unkink the urethra to make it easier to urinate. When it is in, you shouldn't even notice it. It should be completely comfortable. That's why we have all sorts of shapes and sizes that we fit to your body.
Do women leave it in to have sex?
It is usually not comfortable to have sex with the pessary in. Some women manage their own pessaries and take them out every night or whenever they are sexually active, or a few times a week, or once a month, or every few months. Other women who may not be sexually active come to the office every 3 months for one of our nurses to take it out and clean it, inspect the vagina to make sure it is not irritating the vaginal tissues, and put it back in.
Can leaving it in cause an infection?
No, pessaries do not cause urinary or vaginal infections.
So that's it. You wear this little device like a tampon and it takes care of the leakage?
That's it. It's so comfortable I hardly know it's there, and I can run again without worrying about leakage. I don't have pressure anymore. I can even leave it out for a few days without the bulge coming down. I wish I had known about my options sooner. I'm so relieved that surgery was not the only option. And if I want surgery at any time, I can just decide to have surgery. Otherwise, I can use the pessary indefinitely.